exciting that you guys are here with me tonight. Thanks for doing that.
Sure. Glad to be here.
What did you guys do today in the canine rehab world? As people are entering, we'll talk about what we do today in the canine rehab world.
Well, my human rehab world was actually spent in the human dissection lab, so I was teaching PT students in human anatomy. So we were having a great day with that.
Exciting.
Yeah.
I love this anatomy lab. Yep.
I was kind of multifaceted. I did a little admin work, a little prep for some presentations and webinars that I'm doing. I connected with some mobile vets and some hospice end-of-life vets today. Saw a couple of doggy cases. One that I was actually seeing a cardiologist tomorrow for some kind of crazy, raspy, who knows what.
Mm-hmm.
And then was managing teenager and aging parents. So
life stuff, doggy
stuff,
life stuff,
real life stuff.
I get it. In my animal world today, I think we saw, it was a slow day for us. I think we saw 14 patients with 6 inpatient standard post-op TPLOs and FHO, a back dog, and then the rest were our regular outpatients coming in for their treadmills or Therax or modalities, whatever they had going on.
Good times.
Yeah, it was good times. So I'm just going to post here. I posted to the comments section. All of you, thank you for coming tonight. We're really happy to have you. If you have any questions, please post them in the comment section, and then we can see the comment section, or Tara could potentially post your questions up on the board here too. As you guys are coming into the webinar tonight, I'll just get started by introducing myself, and then we'll start moving on with learning tonight, what is animal physical therapy? And as you guys are coming in, if you want to post in the comment section, if you're actually a working animal physical therapist right now, if you're new to animal physical therapy and just wondering, what is this thing and should I do it because it sounds cool? Or if you are just curious because it sounds interesting and you have a dog who had a TPLO. So if you don't mind posting in there so we can kind of see what the audience mix is looking like. My name is Sasha Foster. I am an animal physical therapist, and gosh, I've been doing this for a long time. My primary job is at Colorado State University's veterinary teaching hospital. I was hired there to start the rehab department, and I built the human model of rehab in a veterinary teaching hospital. So we see everything from post-op hit by car cases to snake bites, because laser works really good at decreasing swelling in a snake bite, all the way through to geriatric care. And I get to work with all the different specialties. I also own a couple businesses in the realm of animal physical therapy, and I also love to collaborate. Like, it's my favorite thing in the world. So it's really fun for me to do these webinars with you all, because I can invite people on, and it's just like sitting on my couch. My blue couch is behind me, but I'm sitting in my office. But people come over and just sit on my blue couch, and we just jabber about whatever. So welcome. We'll just hang out and talk about animal physical therapy. Before we get started tonight, I really want to thank our sponsor. Our sponsor tonight is Canine IQ. And so I get it right, I'm going to read it. Canine IQ offers advanced, evidence-based education for licensed physical therapists who want to expand their practice into canine physical therapy. Through the Transitional Canine Physical Therapy Program, participants gain hands-on skills, veterinary collaboration, and clinical insight to confidently treat canine patients. With a focus on professional excellence and interdisciplinary learning, Canine IQ empowers PTs to elevate care for dogs while building a fulfilling and impactful career. And we can definitely touch on that fulfilling and impactful part, because it really does change your life moving over to the animal rehab side of life. I see people are still trickling in here. So while you're trickling in, I'm going to show you something new and super cool. What is up at the Animal Physical Therapy SIG? we get this super cool new community board. I am going to show it to you. And if you would like access to this new community board, you can reach out to Tara. She can put her email in the comments maybe for you, or put the link in there for how to get hooked up. So basically what this is for us is it's just a community chat board, which is fantastic. So you can see today I was chatting with Vicky from New York, who was wondering if there was any legislative stuff happening in New York so PTs can practice there. My response was, hey, come meet us tonight. And then so you all know, we've got a series of webinars coming up. October 16th, what are the steps to becoming an animal PT? November 18th, how the heck do you get licensed in animal physical therapy? And this is where we'll really bring up the legislation. And then in December, we'll talk about why PTs are important to pet outcomes. There's a lot of really cool stuff that happens when you shift to the animal world. So if you haven't joined the community yet, definitely join the community. It'll be super nice to look into that. Shall we begin?
Why not?
Why not?
Why not?
Why not?
So that's such a great response, actually, because should you work with animals? Why not? Right?
Why not?
Why not?
Yes. Let's work with animals. Let's introduce you two first. So you all might already know Amy Hesbach. She has been your SIG president in the past. Gosh, Amy, like when I was thinking about this, you were my teacher.
Oh my God, stop.
I took courses at CRI when I was here in Fort Collins at CSU.
Right.
And you were teaching neuro.
Yep.
And you put a dog in the light gate, and that light gate is the same light gate we still use in clinic today.
Awesome. It works well.
So if anybody wants to know,
Right.
should you buy a light gate? That one is like, I don't know, 20 years old.
Yeah, it's probably 20 years old.
Yeah.
That's amazing.
So Amy's really like, gosh, you have taught all over the world, but Amy really has a good tilt on education, not just for us, but also really for the patient-client interface. And you can check out her website and see all of her offerings. Lots of education, and she's got years and years of experience. And then Kirk Peck is joining us tonight. Kirk is our guy for legislative efforts. When he said to me, Sasha, I'm going to give you my list of all the things I've done, it would take us the whole thing to do this. So I'm just going to highlight that he's collaborated with the Nebraska Board of Veterinary Medicine and Surgery to create statutory and regulatory language for PTs to practice on animals via licensure. So Kirk is our go-to guy. When he joins us again in a couple webinars from now, he'll join us with Karen Atlas to talk about legislative efforts. And then we'll actually hopefully be able to upload for you into the community board. There's a place where we can put, here's legislative language, here's a path to legislation, etc. So as we add things, we can just add them to the board. Is there anything you guys want to add about yourselves that I didn't say?
I would like to say two things. We will talk about legislating later, but I would say even more important than my Nebraska work is what I do at the Federation of State Boards right now. And so we recently just got finalized. The board approved some regulations that will supplement our Model PT Practice Act and the Federation of State PT Boards. And that is what I'm going to highlight in a future webinar, because it's really the key thing for states to look at that want to change laws to make it legal for PTs to work with this. So we do have some significant national support, not only through APTA, but through the Federation of State Boards, which will help out our boards. Also, I just want to bring up, people may or may not know me doing this stuff. I was past president of the SIG as well. So you got 3 presidents here, 2 past and 1 current, that have really great experience with the SIG. So obviously we're going to be strong promoters of that. But I also work in the equine world as well. So you get the canine and equine perspective. I'm both canine and equine certified and teach at the equine program in Tennessee. So I'm open to questions for people who have interest in that as well. So from that perspective, you've got a pretty good balance here with a couple of us on here. I'm excited to hear all of Amy's stuff. She is well traveled and experience. So it's going to be kind of fun.
I know. I'm excited to just hang out and visit with you guys. So the community knows there are a group of past presidents that get together and just kind of have meetings every now and again to talk about kind of what the state of the world in animal physical therapy is. And so what's great about this small group of past presidents is we've got, I don't know how many years of experience between everybody. And so what it really does is it gives us not just like, hey, we can identify that we need legislative efforts, but what are all the nuances that happen all over? So we will bring all of that to you as we slowly roll this out. But let's start with fun stuff tonight. I'm looking in the chat right now. It looks like we have a number of people who are interested, students who are interested, people who are certified and practicing. So we've got a real mixed bag. And then we've got some of our also really fantastic, I don't want to say senior members. How do I say it? Experience. We've got more experience online with us too.
Vintage members.
Vintage. Oh my gosh. We're in an antique store.
Yeah,
Right? I was thinking fine wine, not antiques.
And I do know that a few of them also are drinking wine right now. So
I'm sure they are.
Yeah. If you want to grab a coffee, a wine, whatever makes you happy as we sit and have a conversation, that sounds great. All right. So you guys, what is animal PT? What is this thing called animal PT? So if the two of you run into somebody and you tell them you're an animal physical therapist, what do you say to them? Like, what's the wow factor? How do you explain it?
I can go. I don't care,
ahead,
Amy. I get so excited about it because I always tell them, look, everything you can do as a PT with humans applies to animals. Once you learn some of the basic competencies in anatomy and biomechanics and physiology and those things that go with the additional training. But for me, the wow factor is you actually can make a huge difference in these animals' lives, and not only the animals, but the owners. And there's such a the psychosocial component that goes into this that goes unspoken so often with working with animals. And that's the part I think that's exciting because I teach students, I'm in an academic program, been teaching for years. So I get a lot of students in the programs very excited about this stuff because I'm like, you guys don't realize what you have to offer. No other health profession really has to offer in the unique way that we present. And part of it is we're really good with people. We work with people. It's what we do with our human practice. And you're skilled in that. And that is a skill set that really is advantageous in the animal world. And so for two reasons, in small animal world, I feel like it's hugely important because you're always educating the owners of the animals to do some of the therapies with them. It's added bonding to those small animals. And of course, in the equine world I work with, you have to still be treating humans. So I will promote the human component to that because you got to be treating the rider on the back of that horse. They're a large component of the horse problems. So you maintain your human skills along with it, which is phenomenal. And you make such a dramatic difference so quickly when you work with either horses and the riders or you're working with small animals, and you really bring such great pleasure to those animal owners who may have a geriatric dog that's been stiff and arthritic and can't move and go for walks. And within a short time of a week or two, and you've done some manual therapies and treatment with them, and you show them what to do, and all of a sudden the dog is making such a difference. Everyone is noticing. They're play bowing and running around the house. It's amazing. And that's the wow factor to me, is the gratification I get in helping with those, not only the pets to see them get better, but the owners as well. That human factor is still there. And that's the heart and soul of why many of us went to PT school in the first place. So your skill set is incredible.
Yeah, really, really good points. What about you, Amy? What are your thoughts?
You know, it's funny because I've been in this practice for over 25 years now, along with quite a few of you, Carrie, Lisa, I saw you guys join in, and I remember ages ago telling people what I did as a physical therapist. I'm a physical therapist, but I work with animals. And as I would tell kind of just friends and people that I would meet, they'd be like, wow, that's interesting. How do you do that? Are you a real physical therapist? I still get that question. Are you a real physical therapist?
Yeah.
And I think a lot of people wonder, well, how do you do physical therapy on animals? Don't they run away? Isn't it too uncomfortable for them? And, I always tease that, if I could give a cookie to my human patient on the plinth, they would probably be more compliant and more happy and satisfied with their therapy too. It's all about that positive association with movement and exercise, and animals want to move. They want to get better. They are more compliant, I think. They're more appreciative sometimes than our human patients. But Kirk brought up a really good point in that we're not just treating the patient, but we're also treating the client, the owner. And I've found a transformation in a lot of pet owners in that they're seeking out physical therapy, maybe because they've already had their own positive experience with physical therapy, or they maybe didn't have a great experience in physical therapy and they're a little bit doubting that this could help their pet. When they see it help their pet and they see it help them as well, getting into a more compliant exercise routine or walking program with their pet, it establishes that bond with them and makes a believer out of them as well. I think when I first started talking to PTs about what I did 25 years ago, I was kind of a bit shy about it. I'd go to APTA, CSM, and, the SIG, we were this little group and, kind of in the back room and, hush, hush, and that's not real physical therapy. And then I realized that a lot of the kind of movers and shakers and even more vintage PTs, in the orthopedic section, they've all had their hands on animals. They've treated pets, their own pets, friends' pets. They've treated horses. They've treated zoo animals, and they know that it works too. So I think that, that's something that's so satisfying as a physical therapist, that my patients get better, that it restores my, I guess, confidence in my skills and confidence in my knowledge and understanding of physical therapy and movement science and all these things. And, just really so rewarding for us to help animals and help the owners through their animals too.
And I remember when I was brand new animal physical therapist and I had the freedom without insurance to just completely practice physical therapy. Oh. And when I could do all of the things, right? When I could do from arthrokinematics all the way through to biomechanics with therapeutic exercise in one session and charge one fee, and the animals get better so fast when you can do that, right? Nobody's saying you can only do one unit of this or that. So for me, that was so impactful because like you're saying, Amy, like for me, I thought I had good skills. My humans reported I had good skills. I would see some good outcomes. But man, when you unleash a PT in an insurance-free world, you can really see huge gains very quickly. And because the animals don't have that psychological component, they get better pretty fast too.
Well, and even with the introduction of insurance, that the owners are still in charge, right? That team is more of a team. It's the owner, the pet, the veterinary specialist, the physical therapist coming together and working towards that same goal, and not being adversarial and working against each other or manipulating things to satisfy insurances and this and that, rather than negotiating with an owner or with a patient and saying, well, I need you to come in twice a week, or I need you to come in once a week. They're asking, how often should I come? They're asking for that information. They're seeing the transformation and the changes in the short term and wanting, more and more. Mm-hmm. I feel like too, I have such a relationship with the pet owners that, I've been practicing for quite a long time, but I see the same families, I see the same pets, I see the second and the third pets. And, I see them from puppyhood until, end of life, and really become part of the family in a way. It's somebody that they reach out to when they're concerned about their pet's well-being and mobility and function. But also looking at it from a preventative perspective. When they get that new puppy, how do they prevent potentially like a disc injury or some other type of injury? They're more aware because of our interventions and our education.
And so dedicated, right? I was just thinking, we have a couple of clients at CSU who literally moved so that they could be around the CSU system, right?
Amazing.
So, I mean, that's how dedicated these kinds of owners are. And then there's the owners who can't afford that much, but that's okay, right?
Yeah.
Because you can still unleash your full physical therapy tool set onto a case, you can still really help them. And with the client education piece, and spending time with clients, explaining things to them. Yeah, that's one of my favorite parts about it. But shall we each tell a story? Kirk, I know the story I wish that you would tell, but I'll see which one you picked. The question is, can you share a powerful story or case that captures the impact of animal PT on pets and owners?
Which story do you want? Because I can share that one.
The horsey one, the horsey rider one.
Yeah, I would be happy to share that one. I actually started for the first time because one of the things I love doing is sharing with our students, trying to get involved with this is kind of the new wave is clinical education, right? And how do you do clinicals with animals? And so I had one of my students who actually acquired a PhD out of Michigan State, came down to our program and went through the program with me and set up a clinical. And we did an equine clinical all spring semester where we went to a barn and worked with some hunter jumpers and things like that, and had an incredible experience with a hunter jumper rider, a professional rider here locally in Nebraska. And her horse was having some left hind hip related issues. So we took some early videos and you could clearly see some stiffness in the hip of this horse. And when you see this biomechanically, it will demonstrate itself as sometimes low back pain, SI joint problems. And the veterinarians in the equine world don't really look at the hip as a big problem. They're usually looking at SI joints, or they go down to the stifle in a horse and they kind of skip the hip because it's not really a common cause of lameness unless they're severely arthritic. However, they can get stiff and everything just like in a human, right? And so we picked up on this stiffness during the trot and we took videos of this horse. And so the rider was telling us about the hip problems, and the horse was jumping and it was crooked and things like that, and knocking some rails during competition. And so we took the horse and started treating the hip. And then we asked the rider and we said, look, we would like to do a case study with this. This would be great. And I said, do you have some issues? And she goes, oh yeah, 20 years ago, I had a horse, I got pitched off a horse, the horse fell on me and I fractured my pelvis. And said, she's from Canada. So her rehab in Canada for human PT was, she had to have an ORIF. She had internal hardware put in her pelvic region, her pubic symphysis, everything was disjointed. She showed us her x-rays. I have a case study that shows all this stuff. But anyway, she showed us this stuff and like, oh my gosh, what was your rehab like? She goes, the moment I got out of a wheelchair at about 6 weeks out of surgery, the PT said, you're discharged, you're done. That's all the rehab she got. And so she never really went through full rehab on her hips. This is 20 years ago. So I said, look, I bet we're going to find some hip problems with you. So we took some pre-videos of her jumping on the horse. Of course, when she goes over the jump, she's crooked. She went to the right and the horse went to the left to counterbalance. And this is a professional jumper, mind you. This is a horse that's jumping, almost 5 feet in the competitions. And so I said, look, I tell you what, let me work on your hip and we're going to keep working on your horse's hip. And I'll bet we can make a difference with this. So in a 90-minute treatment session, we worked on both horse and rider. We had been working on the horse, but we had worked out in about 3 weeks. This horse was almost all better on the hip and she could feel it under saddle immediately. And I took her on her back and I showed her, she had severely limited range of motion to like 90 degrees of hip flexion on her right and left side. Pulled out my mobilization belt, did a bunch of mobilizations. Long story short, we gained 20 degrees of motion and hip flexion in her hips almost just in one session, an external rotation. She had never had anybody work on this before, actually her internal rotation. She gets back on the horse. We re-videotaped her in a 90-minute period. We did this, and she gets on the horse and jumped perfectly straight. So on the videos demonstrate this perfect. And she's straight on the horse. The horse is straight. He doesn't hit any bars. She ends up going down to Tennessee and competing and was in 3 different competitions, never knocked a single rail over for the first time ever in this horse's life. But the amazing thing was, as soon as she got done after we treated her and she did the jump, she's still sitting on her horse. I handed her my camera and I said, look at this video. Look at what just happened. You're perfectly straight. And she goes, you know what else? That was the first time in 20 years I never felt my hardware in my pelvis. Wow. So every time I do the jump, she was feeling her hardware in her hips for 20 years and never even thought that PT could even help that. So it was an immediate fix with her hip in her and the horse as well, instantaneous. And she just said, I can't believe this. And that's how fast it changed, but it also altered her horse so quick. She goes, my horse's hips 100% better. We did all the stretches and everything we could do on the rear end of this horse, and it was incredible. This is a high-level horse. So that may not even be the story you wanted, because I've got others that I could tell. But that's a very similar story that we get with the horse and rider biomechanics and working in this. And so the beauty of that is, look at the phenomenal PT skills you get to utilize, not only with the horse and the animal, but with the rider as well. And talk about not only making a difference, you're talking about a money-making animal here. This is a competitive horse that's out generating, competition and revenue. And these are really, big-time deals. So very exciting stuff.
And think about how you prevented an injury in that horse, right? So had that horse been riding abnormal biomechanics at that high level, its likelihood of injury went way up. You saved the horse and rider all the pain, the injury, the money.
Yeah, and this is a high level, worth a lot of money horse type, one of those deals, but definitely would have progressed to more and more SI and low back issues, and then even further up the chain. So, by correcting that, and we actually presented our case internationally to a bunch of veterinarians I'm involved with on an international level. A lot of our Olympic vets, so very high level vets. And their first question to me, here, my student and I are the only one on the Zoom as PTs, and they turned to me and said, Kirk, does that mean we need to start looking at the hip as veterinarians a little more often? And I said, I tell you what, maybe you won't look at the hip, but we as PTs will look at that hip. Because
I was going to say, even if they did look at the hip, would they know what they're looking for, right? Or what to do about it? I think that's one of the huge differences that we contribute.
Yeah, it's interesting you say that, Amy, because one time I worked at the very high level. He was an Olympic eventer vet, and I said, "I tell you what, we were at a horse show, and we took the horse, and I said, look, we got to do an eval on this horse. I said, we're going to eval this together. I want you to talk out loud. You tell me what you're looking at. I'm going to tell you what I'm looking at." And then about an hour later, we got done, and I looked at him, and I said, "We didn't even look at the same horse."
No.
Right.
We didn't even look at anything about the same thing on that horse. He's looking on where am I going to put that needle and inject. Yeah. And I'm looking at all the biomechanical the whole chain effect of the biomechanics that at fault. All the things we would work to fix on and may not even need any of the injections whatsoever. You fix the biomechanics and the horse is a completely different animal. And he goes, you're right. We didn't even look at the same animal. I said, that's the beauty of collaboration. That's the beauty of working together, because honestly, you get the perspective of two professionals coming at it from a completely different perspective. Mm-hmm. And who wins? The horse wins. The rider, the owner. I mean, in that case, it's a multi-win factor, right? When you get that kind of level of expertise to do that and doing it at the same time. So that to me is gratification in the animal world, is being able to do those types of things.
Yeah, that's a great story. Yeah, it perfectly illustrates that connection between the horse and the rider and the skills and the impact, right? Makes a lot of impact. Yeah. Amy, what about you? What's one of your favorite stories?
Oh, I have, over 25 years of stories, but some of them at the dinner table and some of them, actually as Kirk was talking about, his evaluation with the veterinarian, and this is probably a topic for another day, but we don't need to teach veterinarians to think and feel and see like we do. We need to appreciate what they bring to the table, and they appreciate what we bring to the table. And collaborating is really where we're going to excel. Because first and foremost, you're a PT walking in there, you're going to look at things differently, you feel things differently. One of my recent successes, and I can't even take credit for this because it really was a collaboration, and probably the person who contributed the most to this was the pet owner, and the pet owner was actually a physician. A great guy, but he is a falconer, and he also does hunting with his dogs. He has 2 German short hair pointers, very sweet dogs. But one of them last winter kind of probably chased a deer or something across the road and got hit by a car. He didn't even realize the dog had gotten hit until the next morning when she was 3-legged lame. She wasn't complaining at all. Some of these dogs they don't complain, especially the working dogs. And so he took her to the emergency vet, the referral center that I previously had worked at. And actually, to just give you a little bit of background, for me, I used to work in Maryland. I worked at a referral center and a specialty hospital and really learned the ropes there from the specialists. When I moved to Massachusetts, where I am now, I worked in an even larger referral hospital that I still have a great connection with. But now I do mobile PT, I do home care, and which is fabulous because it's really one-on-one with the owner and with the pet. Anyway, so this poor dog, went in to the emergency vet, went in for surgery. They were going to do an FHO. Actually, I think they were going to try to pin. She had a femoral fracture and a pelvic fracture. And they wanted to try to repair the femoral fracture, but as they were placing pin, it fractured further. So they ended up having to do an FHO where they remove the head and neck of the femur. So they basically have a false or floating joint. And the surgeon and the owner are thinking, there goes this 5-year-old dog's hunting career. Is really unfortunate because that was really their lifestyle. They go up to Vermont, they go hunting, they go down to Connecticut, they work with the birds and everything. So not saying, taking no for an answer, the surgeon who I'd previously worked with, she texted me, called me, and how many human physicians do that, right? Text, call, email you directly as a PT. She got in touch with me and she said, he's going to give you a call. He's really anxious to get this dog back. What can you do? Can you fit them in? And so I was able to fit them in within the first week after surgery. The dog went home and they had a fabulous setup in their open, floor plan with hardwood floors, and, had baby gates up and put down throw rugs and yoga mats and all the things, and had slings and this and that. And he said, how often can you come? Can you come twice a week? The dog normally goes to daycare when I'm in my office, but I'm going to take her to the office. So he, as a primary care physician, basically set up a space for his dog in his office. So half the time I was treating the dog at the medical office. That's probably not kosher. But half the time I was treating the dog at home. And amazing. This dog and this is without water therapy. This is without all the bells and whistles. This was with my hands, with exercise, with, ice and heat at the right time, with laser therapy, with good nutrition and all the things. And this dog she's back to running, jumping, hiking. She's not perfect. She's not 100% because she has a leg length discrepancy now, but she's using that leg. She's strong. She has great endurance. She's like a little billy goat in the hills. Just an amazing effort from the owner, and great compliance from them. This was one that I kind of had to pull back. And actually it was interesting for him as a physician, having to teach him a lot about tissue healing And, this is how long it's going to take that bone to heal. And this is what the ligaments and joints are going to be able to tolerate. All the things that I would expect a physician to understand, but when they're a general practitioner, they don't. They don't have that specialty. In the meantime, as I'm working with the pet and the owner, my own old dog, sorry, is whining in the background. I know, you're fine. The owner's wife says, I've had scoliosis for a long, long time.
Mm-hmm.
You do PT, but you also do Pilates. Could you work with me?
Yeah.
So here I was tag teaming them,
Yes.
one-on-one, owner and pet.
Mm-hmm.
Cash pay, which is fabulous, but not having, again, that insurance company overhead telling me, you have to do this, you have to do that, you're only reimbursed this amount, having the freedom to be creative and to really address the goals that they had set for themselves and for their pet. So yeah, and it's great because still the owner will send me videos of Bella hiking in the woods of Stowe, Vermont. And I'm like, hey, wait a second. Don't you want me to come up there and treat her? That would be lovely.
She needs a tune-up. She's ready for a tune-up.
Yeah, right? I'm like, oh, wait a second. She's still a little lame. She does need a little more therapy. I'll meet you up in Stowe. So yeah. You have to admit, the two of you, and I'm sure anyone else, it's all you meet so many amazing people through this work, right? Like so many interesting stories, so many incredible backgrounds. Like it's really fascinating, and a great connection. My daughter loves to hear my stories of the famous people we meet or maybe don't meet, the famous animals that we meet. But it's truly rewarding and so much fun.
The case that I was thinking about is a neuro case, a dog who had a stroke, and it's fairly uncommon for dogs to have strokes, but he presented with severe extensor rigidity, and he only had a partial vision to start with before his stroke. And so we worked neurologically, got him in the light gate, Amy, that you trained me how to use. And then we got him walking with support, but we couldn't get him to transition over to walking without support. And so one day I just had him stay with me in my office all day long. And we basically did behavior modification, which if you all are interested in behavior modification, there's a whole world of really cool stories and interesting skills you can learn to communicate with animals so that you can really work together in this therapeutic way. So I was using behavior modification techniques with this dog and working at my computer, and pretty soon out of the corner of my eye, he walks across the gym. I was like, yes, buddy. And then really exciting for that dog is when he left the hospital, I'm not kidding you, people lined the halls and they were cheering him on as he walked out of the hospital. Now, was he walking perfectly? No, he was super tilty, but he was walking independently out of the hospital, and everybody's tears are going down their face and everybody's cheering for him. So, yeah, it's just creates such an incredible community when you're working with animals too, right? Like you're talking about family, Kurt's talking about a barn full of people, like something about the animals brings us all into this community and circle around them, which is really nice, right?
Yeah, what the world needs now, right?
Yeah.
Adopt a dog, adopt a cat.
What the world needs now is more animal physical therapy.
More animals, more animals.
Thank you for joining us. Well, what do you guys think? I mean, a really common question I get is both from veterinarian side, because I work in a veterinary teaching hospital, right? So I'm working with the veterinary students all the time. And then Kirk's working with PT students all the time. And Amy, you're probably working with both. So what is like the difference? How do you explain the difference between human PT in animal PT? Like, what is it?
What's interesting, and I mean, obviously you're maturing as, oh my goodness, she is so jealous that I'm
She
talking.
wants to be on the webinar. Can she come on the webinar? Is she small enough?
This is, and you guys have the same experience. Like, it's the cobbler's daughter, right? It's, as a PT, you never treat your family.
Yes.
As an animal PT, you never treat your own dog.
Yes.
But yeah, so I totally lost track there. Sorry. I think that I have really fine-tuned my observation skills and my manual skills, my palpation skills. I'm sure a lot of it is just being more experienced as a PT, but I equate it to, like watching a child develop and move and looking at quality of movement and then being able to apply that to an animal. When I started doing this work, we didn't have all this slow motion video and all these things all these resources that we have now where we can play things back. And, but I think I apply these skills in human medicine now too, which really makes me a better PT. And what I learn in human medicine makes me a better animal PT. But yeah, it's really the hands, the eyes, all these things, and putting it all together. The biomechanical chain is huge. So
yeah. What do you explain, Kirk? How do you explain it?
Yeah, I mean, I think that's a great perspective. So I kind of do the trifecta. I'm still in the human clinic every single week. So I not only teach students, I'm, academic, but then I also go to a human clinic every Friday, and I maintain my human skills, are always honed in on my orthopedics constantly, have for years. And then I consult with a veterinary clinic for small animals. So I do canine on the side and equine locally and also nationally. So I work a lot with the veterinarians on a national scale and even international. But the canine, I work in the smaller side, and I'm always having to explain myself to a new vet because I work consistently with one small animal vet, have for over 8 years now. He and I work very well together. He's a huge believer in PT. He's had PT himself. Got kicked by a bull when he did large animal veterinary care years ago, tore out every ligament in his knee, and he was a professional weightlifter. And he was a huge guy, and the bull just wiped him out. And he said, that's the end of my large animal career, so I'm all small animal from now on out. Yeah. And he's a phenomenal vet. He's phenomenal. But he says, I love sitting in the room. He'll oftentimes sit in the room and watch me practice. He goes, I just love how you PTs you get right on the floor, you get your hands on there and all your manual skills that you do. He says, that's just something we never did in vet school. He said, it's just so unique how that really helps these animals. And then he's hired other veterinarians, and the other vets, the first thing they ask me, they're skeptical. They like, boy, we just do everything for the dog. What are you going to do for this dog? And they're very skeptical. So the first thing they ask is, what are your credentials? How'd you get credentialed? What's your competencies? And then explain to me what kind of animals you can work with. And I say, honestly, about anything you can actually have, just like in human medicine, we work with everything. There's elements of component of rehab and PT that we can provide no matter what it is, whether it's post-surgical or not. And so then they'll throw out all these examples, obviously the obvious, cruciate issues, or, many of those FHOs you mentioned, the disc issues, neurologic, and they just kind of open up like, wow, I had no idea PT. I never even thought of that you could actually, translate and do that on an animal. So then they slowly start referring a dog to me, and they'll say, okay, see what you can do with this one. And they kind of test the waters a little bit with that. And I think that's, I noticed there's a comment in the chat. How do you market yourselves? The best marketing you can do is really your outcomes. It's how well you do with the outcomes that you provide, and the veterinary word of mouth and your word of mouth. And of course you can do the typical social media, marketing and those kind of things, but your outcomes are going to speak volumes to the vets that you work with. Collaboration to me is really important. So because I love having that bounce back and forth on eval and things. If you need further diagnostics or change in medications, you can work directly with the vet and have those things happen. As long as they trust and believe in your skills and what you're doing. And like Amy said too, I work with so many students. I'm like, you got to really hone in your hands-on skills too, because I mean, this is how we treat people. The evidence really supports the manual therapy and the therapeutic exercise. Modalities are adjunctive. We teach them, you still get tested on them. They're very useful in the animal world, but in the end, it's really your hands-on skills and your TheraX, and then your education, which we all know is a huge part of our practice. And that's where I think we went over a lot in the skill set that we bring to the table. So I still, it always goes back to the transitional of our skills, the transitioning of that. Once you learn the basic competencies, most PTs are lifelong learners. We're always learning new things and techniques to do, but it's crazy how everything that works on humans works on animals. It just befuddles me that the transition isn't as hard as one might think once you get the anatomy and biomechanics down. And you do have to speak the vernacular. You got to speak the lingo with the veterinarians on their side of the fence. So you really do need to understand where the veterinarian comes from in order to speak into that language, but then don't sell yourself short, because you are a PT, you've got these incredible skills, and they learn from you and do that. Since I also teach, Sasha, you were one of my instructors in the canine world years ago, but I also have been teaching for over 8 years in the equine, and I teach with the veterinarians, vet techs, and PTs. And it's interesting. The anatomy is the one thing, and I teach human anatomy now too with our dissection lab with our students. So it's really a fun transition. But the anatomy is the part that I feel like PTs actually have a huge strength in, even in the animal world, because we are looking at the anatomy from a musculoskeletal and orthopedic standpoint. And then you've got the neurologic component in there. And that's really a different approach than a lot of veterinarians ever had. I remember being on the floor when I was going through the canine certification I had years ago. And in my group was probably 2 veterinarians, at least one, or a vet tech. And I looked at the veterinarian and I said, this ought to be easy for you. You got all this anatomy down. The veterinarian looked up at me and said, I don't get any of this. Says, we did not learn anatomy like this in vet school. And I said, really? I said, because this is what we did in PT school. So we know this in humans, and we just translate it to that. And I was shocked by that. I was really surprised by that background differential. And I think that was and I actually see that in every lab I teach in equine. It's the same thing. Even the equine surgeons are like, we do surgery. We don't go around and palpate everything you guys are doing and put our hands on the horse like that, and then mobilize all these joints and everything you're doing. Says that's not how we treat them. So what you're doing is very new to them. And I think as PTs, when we wake up and realize we have skill sets that are very unique, and we are very specialized in what we do in the human world. Amy, you've got incredible expertise in the neuro world that are just, mind-boggling to me. That wasn't the area. I'm always a sports orthopedic guy, but everything is neuro now. Everything is neuro. We tell our students that you got to know your neuro. All orthopedics is neuro, and so you once you start basing that, it just makes it, I think, a lot of fun. But we have a skill set that's really needed, and the biggest compliment I've ever had is honestly after I teach a week long. It's a very intensive week long live horse lab for 5 days. And you have these veterinarians that are very skilled and very good vets. I would work with almost any of them by the time we're done. I'm like, you guys are awesome. It's when the veterinarian comes up to you at the end and they said, when we started this lab, I was very skeptical. What's a PT going to teach me that I don't already know? I've been treating horses for 30, 40 years, whatever. And at the end of the lab, they come up to me and they say, you know what I learned out of this lab? And I said, what's that? And the vet looks at me and he goes, I need to hire a PT. He said, I actually would improve my practice, would be so much better if I could get a PT. He says, then the second question is, where do I get one?
Yeah.
And I say, we don't have critical mass. That's why I'm trying to draw the PTs into this world, whether it's canine or equine. We need more PTs in this world. We have so much to offer in the animal world. And the animals are missing out because our skills aren't in all these settings, and that's the beauty of what we're doing, is trying to recruit and get students excited about this, whether it's full-time animal or a hobby or something on the side. You have a skill set to do this. And I think that's the recruitment tool I always share. And like, you guys, this is so much fun. It's so great. You love animals, right? You got a dog. I had all these students that love dogs. I said, you could be treating these, even if it's part-time and on the side. And yeah, a lot of it majority is cash-based practice. And develop an entire different interprofessional relationship with veterinarians, which we don't often teach about in PT school. Talk about every other health profession, but interprofessional is everybody. And so when you're working with the veterinarians, you're offering a whole different unique perspective about this. And like Amy said, a lot of times those humans that treat, you're treating, they're the owners of the pets, end up becoming your own patients, or you're working with them as a clients, like she did with Pilates and things like that. So that's the beauty, is your skill set just goes on and on and on. And I think that's why it's such a great profession, first of all, but the variety that we have and the opportunities we have as PTs are just huge in the world. And we're trying to open this massive door to the animal world for PTs to consider. Really are.
Mm-hmm. And I do think too, Kirk, you said so much impactful stuff in there, but one of the ones I'd like to kind of bring us back to as we close up this first webinar that we do is the point of collaboration. So just as you were talking about the importance of the veterinarian having access to a PT so they can actually see what the skill set is,
Yep.
I'll reflect us back in the other direction too, so that PTs step into the veterinary world also with an empty cup, right? Because boy, you guys, there were things I did not know when I entered the animal physical therapy world that we started teaching so that everybody knew all the things, but I'll give you some examples. Ascending myelomalacia in a dog who's had back surgery or not back surgery, you can do a clinical test to evaluate for ascending myelomalacia. And it's a clinical test that's super easy to do. You can do it every time a back dog walks into your clinic, but that's a game changer. And when we started teaching how to test cutaneous trunci and catch that, then the PTs were referring back to the veterinarian stat. Because if you get that clinical sign, you're sending it back to urgent care or to the primary veterinarian, not after treatment, but right now. So there's also that piece, and why I love these programs where the veterinarians and the PTs are working together so that you can see some of those things together and learn those things together. Another common clinical example is type 2C common calcaneal tendon injury. So in dogs, the gastrocnemius, the common calcaneal tendon, can lengthen. It's a disease of aging in an older dog, most commonly in Labrador retrievers. This looks exactly like a calcaneus fracture. And if you don't get diagnostics in a dog, then you might be treating a calcaneus fracture. So there's also these parts too. So what do you guys think, like in regards to collaboration and how PTs can approach the veterinary world as they're stepping into the veterinary world, right? Like, how do we do this?
Yeah, I think, one of the attendees, RB, had asked about marketing and, working in the clinic. And, I do think that PTs, we can really stand alone, right? But with our skill set, but we do need that collaboration and we do need that open door. We need to have that communication. I learned so much of what I do through working directly with veterinarians, veterinary specialists, and veterinary technicians and nurses. Really getting my hands dirty, getting in there, almost getting bit, all the things. And that's really made me who I am in the clinic. Again, it goes both ways. When you're starting out, if you're not in the clinic, connect with specialists, ask to shadow them, ask to scrub in and stand on the back wall of a surgical procedure. As you're talking to them professionally, you're using their language, but also your language, which is medical. And you're collaborating as colleagues, not as employees or employers that one owns the other or one has to refer to the other. I had a recent case referred to me. It was a dog that had tethered cord syndrome and had a release. And this is a really new procedure in animals and dogs, and it's just recently been recognized. And I just happen to have the expert in my backyard. So I sent her an email and I said, I'd love to talk to you about this case. I said, I know how to handle this and how to manage this in people, but we haven't seen it so much in dogs. And I want to make sure that my protocol is as you would expect. and that I'm doing what you would expect me to be doing and no more and no less. But then let me also teach you a little bit of what I do and how I would manage this and why I would intervene early and things that I would be looking for that would cause me reason to refer back to you. And we started this really collaborative conversation. She's probably half my age, right? As a neurological specialist. So, I was intimidated talking to her. I don't know that she was of me, but we learned from each other. And, we learn from each other. We learn from the pets that we see. We learn from the cases that we see. We learn from research and, reading the literature. We're not going to improve. We're not going to bring more PTs into the fold. We're not going to grow this field unless we do collaborate and we do, communicate and learn from each other. So I find that my relationships with specialists and even with general practitioners, that speaks volumes. I don't have to market. I just have to find out who is practicing in my area and how I can best benefit them and their patient load or their client load. And like I said earlier today, I, sent a quick email to a mobile vet who's new to my area. And she's like, let's meet for lunch. I was just talking to an owner who could really use your services. And, and I can send cases to her as well. So, it's a give and take. It takes a lot of time to do that and establish those relationships, but I find that they're so much more rewarding. In the same way, word of mouth with pet owners, whether they're the sporty guys or not, the sporty ones, they all know who the right practitioners are. It's sometimes hard to break in, but once you do, some of them want to share and others want to keep you really close and, and they have that competitive advantage because they have their PT, on call. So it's a fine line that we have to walk sometimes, right?
Are you the secret weapon?
Oh yeah. That's
so you get
the world team has me on speed dial. I'm like, oh guys,
it's like
not to be political about it too. I think that's the thing. It's like keeping the pet in mind and trying to benefit them, but they're, it's a competition for them. They all want that spot on the team, and
that's funny. In the horse world,
kind of wild.
Just to add to that real quick, in the horse world, the high level competitive world, there's a flip side to that. Because the owners, nobody wants anybody to know their horse actually has a problem.
Oh, right. Right.
So, because remember, all horses are for sale. All horses have a sale price. Eventually, a price will stick.
Yeah.
And they have to be very careful about that. So sometimes as a PT, you kind of got on these covert missions to treat horses because you can't be known that the horse is actually having therapy for something. Even if it's a minor issue, there's performance enhancement we do with horses, but there's then also, treating of issues. So they're very protective. There's a huge protection, of secrecy with that. No HIPAA laws, but there kind of are these weird HIPAA laws.
Oh yeah. But it's funny that you mentioned that too, Kirk, because I know that we've all had some reach internationally. And when you talk to, practitioners in other countries, there are different animal welfare laws and things such as that, where, pets who are on NSAIDs or have had a specific surgery, it's not, it's actually against their welfare rules to allow them to compete in athletic competition. So, so you do kind of see how, is it an advantage or is it a disadvantage? And, again, looking at the ethics and trying to best benefit the pet and, and their mobility and quality of life.
Yeah.
Well, you guys, we've reached our time here. This is a fun conversation. See, we could just keep going on. This is what it's like when you come sit on my blue couch.
I might have to open a bottle of wine if we do.
I know. next time we'll do
late on the East Coast.
We'll join Carrie and a couple of the other people who cracked a bottle of wine to come to our fun conversation tonight.
Exactly.
So y'all remember, if you want to join the community and post any questions there, I know we didn't have time to answer a bunch of questions tonight, but also remember we've got on October 16th, the steps to becoming an animal physical therapist. Carrie Adrian will join us for that conversation. And on November 18th, how do you get licensed in animal physical therapy? And Kirk is going to join us for that again with Karen Atlas. So thank you guys very much for joining me for a conversation tonight, getting us started on our first animal PT webinar.
Thank you.
Thank you.
And I threw my email into the chat. If anyone wants to reach out, if they have any questions, I'm happy to reply, and, feel free to nudge. I think a lot of times you need somebody to hold your hand a little bit or push you off the cliff. I'm not sure which.
I always
over to the dark side, right?
I'm a push off the boat kind of girl. Just, you can do it. You can do it. Yeah. And then I put my website in there too, you guys. I will get back to you in the community. If you guys post things in the community, I'll jump in there. Please don't email me. I get inundated every day with emails. There's no way I can get back, but post to the community. I'm happy to chat with you there. Thanks so much for joining us. And we'll see you next month. Bye.
Thank you.
Thank you.
Take care, everyone.
Bye now. Take care.
Have a good night.